Hello, how's everybody doing? It's me, Myra. Time for another anatomy lesson. Been a few weeks since we've been on, but we're back. This week's lesson, we're going to be talking about the musculoskeletal system. There are 600 muscles in the human body. They are consisted of three different types: cardiac, smooth, and skeletal. So what are the differences? Cardiac is an involuntary muscle. It is around your heart. It's your heart muscle. The other two are skeletal and smooth. Once again, the cardiac muscle is in your heart, involuntary, which means that you can't tell it when to contract, when to move. It does it on its own. Smooth muscle are the ones that line some of your hollow organs, such as your esophagus, your stomach, your intestines, your reproductive system, your digestive system, okay, your urinary, like your bladder, your urethra, okay, your ureters. Those all are involuntary, just does it by itself. Skeletal, on the other hand, is muscles that your body, you think I need to move my finger. So sends the impulses, the muscles move. Okay, if I want to point, then do this. My brain tells my finger, hey, move that finger, and it tells the muscles to move. Okay. Skeletal, once again, it's the skeletal, that the movement. Okay, my finger, my head, my eyes, my legs, those are skeletal muscles. I think it, I need to close my eyes. The muscles in my orbits, my face, contract, flex. I can open my eyes, close my eyes. That is a skeletal muscle. That's voluntary. Okay. Involuntary, once again, cardiac, your heart. It's going to do it on its own. Okay. Smooth. Once again, those muscles are in the organs. Okay. Once again, it's going to be, for examples, your esophagus, swallow. It's going to move whatever I have in my mouth down, all the way down to my esophagus, my stomach, my small intestine, my large intestine. It's going to move that food or drink or whatever it is all through my body until it's time to get rid of it. Okay? So cardiac, smooth, and skeletal. Cardiac is not voluntary, so it's involuntary. Smooth is involuntary. Skeletal is voluntary. Okay? There are 600 muscles in our body. Not going to go over every single one. I am going to show you some pictures in just a second. We'll go over a few of those so you can get kind of an idea of where they are. Okay? The skeletal muscles are controlled by the somatic nervous system. Okay? They work with your bones, your tendons, ligaments to support your weight and move you. Tendons attach skeletal muscles to bones all over your body. Skeletal muscles, once again, are voluntary, which means they move when you think about moving that part of your body. Some muscle fibers contract quickly and use short bursts of energy. Others move slowly, like your back muscles that help with your posture. Cardiac muscle makes up the middle layers of your heart. It doesn't exist anywhere else in your body. Cardiac muscle squeezes and relaxes to help pump the blood through your cardiovascular system. Smooth muscles. Also, they work by your autonomic nervous system. They're smooth muscles or voluntary muscles that line the inside of some hollow organs. Once again, they regulate body functions. Some examples are digestive system, respiratory system, urinary system, reproductive system. Helps with your vision, your hearing, breathing, speaking, and swallowing. Digestive foods, gets rid of the waste. Once again, part of it is your esophagus, some is your stomach, your intestine, your large colon, rectum. You get the picture, okay? It moves things that are sitting still, okay? Like you just had a sandwich, okay? Goes to your esophagus, goes to your stomach, has to get all the gastric juices. We talked about this in a previous lesson. Gets all the nutrients out, pushes on down the line, right? And all along, these muscles in your intestines are squeezing and releasing and moving all the food down to where it actually becomes poop. And then that starts again, just keeps on going down. It's no longer food now, it's stool. Goes on down to your rectum, muscle in your rectum, releases it, and it just keeps going, okay? So once again, the cardiac muscle pumps the blood through your heart to your blood vessels. We've gone over that already. Reproductive, the muscles in the uterus tells it when it's time for the baby to be born. Muscles contract, open up, helps keep everything going. Baby comes out. That's another involuntary. You can't tell it when it's time. Your body tells you when it's time. And then we go, right? So your muscles are made of thousands of small fibers woven together. These fibers stretch and press together. It's what moves your organs or your body. Your muscles weave together like a quilt that covers your body. They run in all directions, working together to move you. Okay? Different tests. If we wanted to test our muscle strength or whatever, we could do it by blood test, EMG, MRI, ultrasound, or even maybe a biopsy might be needed if you have some kind of growth on your muscle. Is it a tumor? Is it not a tumor? They could do a biopsy of the muscle to figure out what you might need. Okay? I am going to turn you around for a minute, and I'm going to show you two pictures of the musculoskeletal system, and I am just going to go over a little bit of it. We're not going to spend a whole lot of time going over every single one, but I wanted you to see where these muscles are in relationship to the body, and some of these you might have heard before. If you exercise a lot, you might have heard of some of these muscles. Let me turn you around. And here we are. This is a front view musculoskeletal system. Front view. You probably heard of your pectoralis major. That's your pecs, also known as your pecs. Steroid, mastoid. It's right here. Trapezius, your traps. Your rectus abdominis here. External obliques, you do a lot of sit-ups. This is also known as your six-pack. Serratus anterior. Your deltoid, it's an upper arm. That's where some people use for giving shots. Your deltoid. Your bicep, there's your bicep there. Palmaris longus. Flexor carpi radialis is here. Brachial radius is there. Flexor digitorum facialis. Here's your fingers. Lubrical. Gluteus medius, close to your hip. Tensor fasciae latae, there. Rectus femoris is going to be in your thigh. Pectineus. Sartorius, right up here. Adductor longus. Gracilis. Tibialis anterior. Gastrocnemius. Soleus. Okay, coming on this side. Extender halceus brevis, your feet. Extender digitorum, so digits, that's your toes. Peroneus longus. Vastus medialis. Vastus lateralis, so one is medial, one is lateral. External oblique again. Serratus anterior, so we know that's in the front. Rectus abdominis, right here. This is the posterior. We're looking at the back of the person. Your traps once again here. This is thoracolumbar. Deltoid is here. Teres major. Tricep. Latimus dorsal. Extender digitorum. Extender carpi ulnarius, which means close to your ulna. Extender digiti minimi, close to the wrist. Gluteus maximus, those are your butt cheeks. Vastus lateralis. Gracilis is there. Semimembranos. Semitendinosus. Bicep femoris, that's your femur. Gastrocnemius. Scelius. There. Okay, back around. So what happens if we strain a muscle? What can we do? First, they say rest. You might have to put ice on it, heat on it. Important that if you're going to work out, that you do warm-ups first. Don't just get on the treadmill going 3 miles an hour. You want to take care of your muscles, okay? When should you seek medical attention? If you have chest pain, we already know that the heart's a muscle, okay? Chest pain, heart attack symptoms. You have trouble breathing or swallowing, okay? Loss of balance, could be a muscle injury. Sudden worse vision, could be something going on with the muscles in your eyes, your orbits. Controlling your bladder or your bowel. Those are muscles around there. So to make sure those are in good tip-top shape. So once again, you always want to stretch and warm up. Some things that, I guess diseases, if you want to call it diseases. You could have an infection. You could have the flu, COVID-19 of course. ALS, a debilitating disease through the muscles, okay? Cardiovascular disease can affect the heart, right? You also want to just make sure that you have all of your tests, your annual tests done. Make sure digestive system is working I think it's like 10 years for a colonoscopy. You want to make sure digestive system is working properly. The muscles in your digestive system are working properly. Respiratory around your lungs. So there is muscles. Okay. Take a deep breath in. Your muscles. Then when you release, air in, air out. Those are muscles. Okay. Urinary system once again. I hope you've enjoyed our lesson. Take care, and I will see you again later. Bye-bye.